Hello, my name's Joss. I'm one of the osteopaths at the Pure Vida Clinic in Reigate. Today I want to talk a little bit about osteoarthritis and go through a few helpful exercises for people who may be suffering with this condition. Now, a little bit about osteoarthritis. It's an age-related condition which tends to affect the weight-bearing joints of the body. Typically, the knees and the hips are the ones that are affected. Now, the management options for this condition do vary depending on what you're looking to do with your body, how it's impacting those things. These can all help, influence what management options you decide to go for. Now, from a non-surgical point of view, there are a few things you can do. I tend to use a little bit of hands-on, which can help you keep compliant with your rehabilitation. But rehabilitation is the essential thing, or some exercises to strengthen the muscles in the thighs and in the hip. That's really what we're looking for here. So essentially, when you're strengthening these muscles, it helps improve the overall control and support that they can offer the joints, and the joints themselves also undergo positive adaptations as a consequence of the exercises. Now, you can achieve a similar thing through physical activity, which exert these areas, but if you haven't got anything that you'd like to do on a day-to-day basis, then these exercises are a good alternative. So there's three specific ones that I wanted to go through today. So the first one, I've got a resistance band here, it's just an elastic band. I tend to go under and cross over. Ideally you want an anchor point behind yourself. I tend to just sit on it, and you're looking to extend the knee as far as comfortable, just control it back down. We're looking to fatigue these muscles, usually sort of 3 sets of 12 repetitions is what I go for. If you're not feeling the fatigue, then we need to increase the weight. So that's the first exercise. The second exercise, now you change the anchor point, so instead of behind me, it's in front of me. So with this exercise, obviously I'm just working the muscles in the back of the thigh now. So I'm just contracting it back as far as I can and releasing slowly. Now I'm not using the full range of motion within this joint, but that's okay. We're just strengthening it up to begin with. Again, I'm probably going to be working for sort of 3 sets of 12 with this exercise. And finally, for a little bit of work through the hips, tend to go for the glute bridge. So all you're looking to do is feet about hip width apart. You're thrusting your hips up to the ceiling, holding it and then controlling it back down, and just repeating that movement. Again, 3 sets of 12, keep it nice and simple. Again, my name is Joss Barrett. I'm one of the osteopaths at the Pure Vida Clinic. If you're struggling with osteoarthritis or have any questions around the management for this sort of condition, feel free to get in touch with the clinic. You can call or email us, and I'll be happy to arrange a call back to discuss this with you.